The Northern Sierra Opioid Safety Coalition formed in 2015 when a group of concerned citizens noticed that there was a lot of deaths related to opioids. So it turns out that Plumas County, kind of like a lot of other rural counties in California and the United States for that matter, had high rates of prescriptions, and subsequently they had higher rates of deaths due to opioid overdoses. The coalition decided that we needed to tackle this epidemic with an all-hands-on-deck approach. We decided that we wanted to try to prevent as many people as possible from getting addicted in the first place. And we wanted to help the people that already have opioid use disorders. Some of the interventions that we worked on included trying to promote safe prescribing guidelines. We wanted to also expand access to medication-assisted treatment for addiction. And we wanted to promote and try to get wider access to naloxone, the drug that reverses an overdose.
I already knew there was a problem. There were many prescriptions coming across my counter that I just didn't feel comfortable with, but I didn't know what to do. I felt hopeless. I thought there was nothing I could do to help this problem, but now I know that's not the case.
As we became more and more involved in this work, it just became crystal clear how vital it is to have pharmacists on board. And when Cassie joined the coalition, we all just let out a huge sigh of relief. I mean, she was already doing this work where she was engaging with patients high at risk. She was doing this work and more, and she just quickly became our pharmacist champion.
Pharmacists are a trusted advocate for their patients. We're knowledgeable, we're there, we're accessible, we are the point people. We can really make a difference in discussing naloxone and opioid overdose with our patients. I've been going around and talking to pharmacists in the community about what they can do. As pharmacists, there's a lot we can do. It's basically just knowing how to do it.
Cures is a good way to look at prescriptions and validate them. Anytime that you have a prescription that comes in for an opioid, you really should be using Cures as a tool. We're looking to see, are they using multiple pharmacies, different doctors, are they really high doses, are they asking for early refills, are they being verbally abusive or very aggressive right out of the gate. Those are good signs. You know, check Cures, contact the provider.
That's what I try to do. Anytime I see something that's a red flag, especially when it's validated in Cures, I try to contact the prescriber and just validate it with them.
Exactly, that's perfect. And you're also looking for prescriptions if they're over 50 milligram morphine equivalents. You want to check those too and just validate them with the prescriber. Make sure that we're filling something safe for our patient.
And I do try to do that as well with our patients that are on the higher doses. I just try to talk to them in person about their higher risk for overdose with these doses that they're on.
That's perfect. And then you also want to try to get other people in the family involved, because the most risky patient is the patient that's taking drugs alone. That is a dangerous situation, especially when they're on the really high doses, their tolerance is lower, if they have any other illnesses, or they're using other medications like benzos. We really want to get other people involved.
Okay.
Here you go. I'm here to get a prescription.
Thank you, Lori. Just give me 1 second.
Okay.
Actually, can I talk to you in the consultation room for a minute?
Why?
I noticed some things on Cures that I'd like to discuss with you about the prescription before I fill it. Is that okay?
Yeah, sure.
Okay, great.
I'm being prescribed hydrocodone, oxy, and a benzo.
And have you ever noticed any bad reactions with these medications?
Yeah, I get really sleepy. I fall asleep easily, and then I get cotton mouth, dry mouth. Yeah.
Have you ever had any difficulty breathing?
Yeah, I think so. My husband's had to wake me up a few times. Like, he's like yelling and almost shaking me to get me to wake up. So.
And how do you feel about that?
Good. I'm okay with it.
It doesn't worry you at all?
I don't know, maybe my husband, but not me.
Have you ever had any family members mention that it's worrisome to them?
No.
Okay, would you be interested in getting a medication on board that could help you in times when your husband couldn't wake you up or you were having difficulty breathing? It could save your life.
Yeah, sure.
Great.
During a consultation, I try to educate patients on risks, red flags, things that I'm looking at that make me concerned. So I'm discussing how they store their medications. Are they accessible to other people? And then personally, I focus on their doses. Different medications that they're mixing, like benzos and alcohol, can be very dangerous. So I try to hammer down those key points so that they focus on those when they go home. Talking about naloxone with patients makes it more evident that there is a risk there. Speaking with them about these things opens up other conversations about how high their doses are, and it really makes the patient think about what's going on and that they actually are at risk.
There have been a number of laws passed in California that make it easier and legal to get naloxone into the hands of people that need it. One of those is it's now totally legal for pharmacists to be able to furnish naloxone to patients, basically prescribe it to them without a prescription. To do this, pharmacists are first required to take 1 hour of continuing education specific to naloxone administration. Then, they need to screen the recipient of naloxone. Screening questions are available on the California Board of Pharmacy website. Next, the patient receiving naloxone needs to be educated on preventing and responding to an overdose. And each patient is required to get a Board of Pharmacy fact sheet about naloxone with the medicine. The patient's primary care provider needs to be notified. Records of furnishing naloxone need to be kept for at least 3 years. Each pharmacist needs to obtain a national provider identifier to allow you to be the prescriber on record. Each pharmacist who furnishes medications must enroll with Medi-Cal for the purpose of ordering, referring, or prescribing. So naloxone is covered by Medi-Cal as a carve-out medication. So it needs to be submitted directly to fee-for-service Medi-Cal, not to managed Medi-Cal. And it's also covered by most insurance plans.
Hi, Jeremy.
Hi.
Thanks for joining us.
problem.
You want to have a seat?
Sure.
Thank you. So I've been discussing some of Lori's medications with her, and we're interested in getting her on naloxone.
Okay.
So I want you to get on board with this because you're going to be the one most likely administering it to her. So I just kind of want to go over with how to use it and when it's appropriate to use the medication.
All right.
Have you ever had difficulty waking Lori up or ever noticed that she's having trouble breathing?
A few times, yes.
Okay, so Jeremy, this is naloxone. This is the medication that we use as opioid reversal.
Okay.
So some signs when you know that you're going to want to use this is if you're having difficulty waking her up, you're shaking her, she's unresponsive, shallow breathing or no breathing at all, blue nail beds, things like that. If you see that, that's when you're going to want to use this.
Okay. So how does it work?
Okay, so I'm going to go ahead and open this box, if that's okay with you guys, and show you exactly how to use it. It's very simple.
Can I do it to myself? Can I administer it myself?
So you won't be in a state where you should ever have to administer it yourself. If you are that responsive, it's not necessary.
Okay.
That is why we want to teach other people in the home how to use it. Also, if there's anyone close to you, like a neighbor or anyone who you think could possibly find you when you would be unresponsive, we want to teach those people too. So I'm going to teach Jeremy today so he can go out and show other people. Okay? So it's very simple. So if you've noticed the signs, you know you need to use it. You get it out, you take this, you insert it up her nose, and you spray it. Then you're going to want to immediately call 911 because we do want to seek immediate medical attention.
Okay. So it's just one push up her nose?
Yep, that's it.
How likely is this going to happen? I mean, what's the chances of him having to do this?
Well, it kind of depends on the medications you're taking, what your tolerance is. Do you drink alcohol with your medications? There's many factors that will come into play on whether you need to use this or not. Hopefully, you never will need it,
Okay.
but it's like a safety net, something to have on board just in case something like that happens. This will save your life.
Okay.
If you don't respond after the first dose, there is a second dose in here that you can use.
Okay.
And like I said, you will have called 911, but sometimes they don't get there fast enough, so you will use the second dose.
Okay.
It's clear we're in the midst of an opioid epidemic. A lot of times we see patients coming in overly medicated, and many pharmacists feel hopeless. But we aren't. We can really better our patients. We have the tools, we have the knowledge, we have laws to back us up. We can really make a difference in the lives of all of our patients. We are really in a unique position to make a difference. Together, we can save some lives.